Welcome to the Council of Scholars and the Future of EMDR Therapy project. I'm Deanie Laliotis, co-chair of the steering committee, along with Susie Matthijssen. On behalf of the council, we would like to take this opportunity to share with you what we're working on towards charting the course for the future of EMDR therapy, a mission that is near and dear to all of our hearts. The Council of Scholars, at the invitation of Michael Bowers, Executive Director of EMDRIA, and Louise Maxfield, then Chief Editor for the Journal of EMDR Practice and Research, first met in 2018 when over 40 international experts in EMDR therapy were invited to get together to address EMDR's challenges in four main areas: research, clinical practice, training and credentialing, and what is EMDR therapy? What is the definition of EMDR therapy going forward? So I'm going to turn it over to the chairs of each committee who will share with you what we have accomplished to date, as well as next steps.
My name is Marilyn Luper, and I have been part of the EMDR community since 1992 and a member of the Council of Scholars Steering Committee since its beginning 2 years ago. Today, I'm speaking to you as chair of the What is EMDR work group. We were asked to develop a consensus definition to capture the essence of EMDR therapy and define criteria that would help us agree on the following: what is EMDR therapy, and how to recognize modifications, experimental innovations, and/or complete departures. We also want to inspire you to become active members of our EMDR community. Our group is made up of 9 EMDR practitioners. Amongst us, we have about 250 years of EMDR experience as we have been working with clients, teaching, and/or doing research. We come from Asia, Europe, and North America, and our meetings cross many time zones. However, whether we are just waking up or almost ready for bed, we form a cohesive unit dedicated to our task of divining EMDR therapy and discovering what is EMDR and what it is not. Our think tank conversations have been lively, passionate, and considerate. Next. We started with the results of my analysis of 65 specialized protocols that were published in my EMDR scripted protocol book series. My findings were showing that the core elements of EMDR therapy were intact, according to Shapiro's 2001 text, and the modifications were related most frequently to changes needed for special populations or situations. Our group continued this work by identifying the core elements of EMDR therapy by reading Shapiro's texts and interactive discussion. Our goal was to preserve the integrity of Francine's vision of EMDR as a psychotherapeutic approach. This task was challenging given the changes in EMDR over time as it progressed from a technique to a protocol and then to a comprehensive psychotherapy. In order to improve validity, we used Shapiro's 2018 text to define our terms whenever applicable and to support her vision and the AIP perspective. We asked the Council of Scholars and Louise Maxfield to review our work, and they suggested that we clarify our terminology related to EMDR therapy treatment. We created 6 sections in our glossary of terms and categories, including items related to our model, our definitions, our 8-phase goals, our delivery of services, our clinical goals, and EMDR therapy outcomes, and our evidence. We added, subtracted, and changed the definitions many times as we came together with our unique perspectives to articulate and hash out their meanings. In reviewing EMDR-related treatment, clinical treatment, research, and training practices, we discovered that terminology could be inconsistent, resulting in confusion. We needed a clear definition of our terminology. We turned to Collins Dictionary and found that the word protocol is defined as a set of rules, and a treatment protocol is understood to be a plan for a course of medical treatment. While some protocols appear to describe an in-depth psychotherapy approach to EMDR, other protocols appear to describe a technique. Based on this observation, the group identified the need to further define and distinguish between EMDR psychotherapy, EMDR treatment protocols, and EMDR-derived techniques as subcategories of EMDR therapy and other definitions for each category. We also propose ways to update inaccurate language used in the EMDR literature. Next, our most current contribution to our field is our paper, What is EMDR Therapy? Past, Present, and Future, that is being published in the next edition of the Journal of EMDR Practice and Research. Next. So where are we going in the future? We're developing the core EMDR therapy scale of sets as a scale to rate the EMDR elements in a specific intervention and help us evaluate innovations in EMDR therapy so that we can recognize when there are acceptable modifications from treatments and when they do not meet the criteria of one of the three categories. We hope that those of you with expertise in creating scales reach out to us. We would welcome your informed help. The future of EMDR therapy is bright as we work together to bring this therapy into our clinical practices, research, training programs, and accreditation standards. There are so many possibilities on the horizon, and we are hoping you will join us in accepting the challenge to bring EMDR to new areas of treatment, to create accessible, affordable, and effective treatment, to inform research through our three categories, and those are just a few examples. The sky is the limit, and we hope that you will read our paper in the Journal of EMDR Practice and Research and become active in the EMDR community. Thank you.
Okay. The overall mission of the clinical practice group is to address the needs of EMDR clinicians as they learn about and apply EMDR therapy effectively with their clients. Within this mission, our group is currently designing a process for establishing clinical practice guidelines for clinicians within EMDR therapy. Simply put, clinical practice guidelines advise healthcare professionals about the most appropriate treatment or care for people and how to perform it. Practice guidelines in medicine date back to Hippocrates, but in the modern era, medical guidelines have more formally been developed since the 1990s, and they are increasingly being developed within the field of mental health. Establishing guidelines within EMDR therapy can not only help us be better at our craft, but it will also distinguish EMDR in the eyes of others as a sophisticated and accountable psychotherapy. While we are in the very early stages of this process, we envision that clinical guidelines can be developed that address particular clinical diagnoses or presenting problems, such as PTSD, depression, addictions, clinical delivery settings, not just individual practice, but agency settings, hospital settings, intensive treatment, and cultural context in general, and also intervention methods, including group treatment, intensive EMDR, short-term treatment, and so forth. A goal of our group is also to make guiding information readily available to clinicians, consultants, trainers, and researchers and other stakeholders. Think about it. If you were a clinician and you wanted to learn about, for example, eating disorders within EMDR therapy, where would you turn? And if you were a consultant guiding your consultee or a trainer wanting to draw from the best available information, you'd doubly want to be sure that you knew how to point, what direction to point them in. Evidence-based practice is an emerging term which represents an integration of three important factors with regard to the development of effective clinical guidelines. Critical component, of course, of any guideline is to draw from the best research evidence available. However, especially when research is limited or appears contradictory, it is also important to discover and evaluate from clinical lived experience expertise. In the end, clinicians are the boots on the ground applying their knowledge, combined with the many clinical factors they must evaluate in making EMDR therapy work for their clients. It's a little finicky here. There we go on the slide. Somewhat simplistically, the steps of composing evidence-based practice guidelines will involve asking a clinical question. And our standard question will be something like, how can EMDR therapy be best applied to this clinical diagnosis or in that setting? After that, the challenge is accessing by tracking down the best available information from research and clinical practice, then appraising and by weighing the different bits of information, and ultimately applying this information in usable clinical guidelines. And overall, this will be an ongoing process which involves reviewing the guidelines, updating information, and make sure the guideline creation process itself is well monitored. One of the resources our group has discovered is the Agree-To instrument for assessing the quality of clinical guidelines. And while we are a long ways from assessing our guidelines, this tool has been used by hundreds of organizations in not only assessing, but designing guidelines. It includes multiple dimensions to consider within these 6 domains. So as you can see, as we put together our guidelines, we'll be thinking not just about the topic of interest, but how to engage stakeholders in the creation of rigorous and well-developed guidelines, and also how to maintain editorial independence so that in the end, our work will be peer-reviewed. Our group realizes that developing and maintaining clinical guidelines is a multi-year task and an ongoing process in terms of evaluating things, but we are eager to get underway.
So now from here, we will take over. And my name is Susie Matthijssen, and I'm here together with
Atte Jong.
and we are the chairs of the research work group. Okay, so the research work group, of course, in our research work group, there are researchers who love to bring EMDR to the next level. And we have specified certain goals for ourselves. And the first one is to prioritize evidence gaps requiring future research and to disseminate also that information, because there are some areas where we are almost there, but not there yet. So we need to do some more research on those specific areas to get the evidence gathered and to bring that out so that people will know about it. And then we can also work on our second goal. We need to ensure that external treatment guideline committees are aware of and have access to relevant EMDR studies, so that we need to make them aware of what is already available in the field and what we have done so far. But we also need a third goal. Well, we don't need, but we set ourselves a third goal, and that is to create multi-site teams to conduct prioritized research. We will tell you a little bit about our 3 goals. So the first one is to prioritize evidence gaps requiring future research and to disseminate this information. So we already talked about prioritizing certain areas, and we were already in the beginning quite convinced which areas that should be. For example, PTSD in children and in adolescents, you see that there is already quite an amount of research, but we are not there yet. So in certain guidelines, it is still not allowed to use EMDR as a first choice of treatment. So we are willing to set up more research on PTSD in children and adolescents, but also to make treatment guideline committees aware that there is already quite some research there. We are on the same page with early EMDR interventions, also combat PTSD and unipolar depression. There is already a lot of research there. Chronic pain is a little bit of a more difficult field. There is already quite some evidence, but the field is a bit more difficult because chronic pain is a condition that you can have with a lot of different conditions, something that you can experience with a lot of different conditions. Not only these areas we selected as prioritizing areas, but we also said that cost effectiveness would need a place in all the research that we should do, because you will find out a lot of times that EMDR works sometimes quite quickly as opposed to other therapies that do not. So it is of the utmost essence to put that in research, because maybe different therapies, so EMDR and another therapy, are just as effective, but EMDR might be more efficient, having quicker results. So what we did is we wrote up all the evidence that was there already, and we made our goal clear what were our prioritized areas, and we put that in a paper. That is our position paper, the current status of EMDR therapy, specific targets, areas, and goals for the future, that we published already in 2020, one of our first results of the research work group.
Yes, Susie already said how important it is to have treatment guidelines and to that EMDR is mentioned in these treatment guidelines. So it's we made a kind of database, you can say, gathered all the evidence that there is already, and do that all the time. So if there is a treatment guideline renewed, or is a new guideline on a certain mental health condition that we are aware of, we more or less provide these treatment guidelines. We make contact with them and provide this information that they really need. Because in the past, so many times we encountered situations that EMDR was lacking in the guidelines, and there was evidence, but they didn't find it, or they didn't want to find it. So in the past, it was the case. So it's a very important that we are in these guidelines, and also that it's how do you come in the guidelines? Then the quality of the research is very important. And in the past, it happened that, for instance, studies were conducted, took a long time to be conducted, and at the end, they were not seen and not considered as important enough. So to prevent that kind of situations, we developed guidelines, a set of criteria that clinicians can use and researchers can use for their studies to be sure that they are on a high quality and enough to be present in the guidelines in the future. Another thing, it remains important to get research done. As Francine Shapiro used to say, research, 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 and she meant that it's the foundation of our future. So one of our goals was also to connect researchers in a certain area, to collaborate and to make networks so that they could set up multi-center studies. And in certain areas, for instance, on depression, there is already a network in collecting data. So yes, it remains important to have these things set up on a certain quality level, that the future is in our hands.
Now I will give the word to Derek Farrell.
Hi, everybody. I'm chair of the Training and Accreditation Working Group, which we colloquially call the TAG Group. So this consists of a international group of individuals from within the EMDR therapy community that are really looking at two sort of core aspects. The first is to do with the teaching and learning of EMDR therapy, and the lens that we're using for this is actually a lens that's very familiar to the EMDR therapy community, because it involves past, present, and future. Is that in order to understand how we can develop a syllabus curriculum that is fit for purpose in the future, we have to understand where we've come from. And so the first part of this project has really been about getting an understanding of participants' experiences of the teaching and learning of EMDR therapy. And I'm going to say a little bit more about this in a moment. The second group that we have is the fact that we know that one of the critical measures that we use to test the quality assurance of a practice involves accreditation or credentialing. And so you'll see that the second group is very much sort of looking at sort of an exploration of all the international variations that exist within EMDR therapy accreditation. But it's also about how can we then compare accreditation criteria within EMDR therapy with other comparable sort of trauma-focused interventions, really. So just to say a little bit more about Project One, the first part, as we say, involves carrying out this international review of the entire EMDR landscape in all of the main sort of regional areas within the world, North America, Europe, Asia, Australasia, because what we have noticed is that there are some divergence in terms of the international accreditation criteria. The second thing that we want to do is the fact that when we start to look at EMDR in regard to other trauma-focused comparators like prolonged exposure therapy or cognitive processing therapy, we find that there are some similarity in their accreditation criteria, but we also notice that there are some essential differences. And so you'll see the fact that the purpose of this project is to develop a fairly comprehensive policy document that starts to review and summarize all of the accreditation credentialing criteria that exist within the EMDR therapy community, but also within the broader sort of trauma focus field. So coming back to the teaching and learning bit, the first activity that we've engaged in is this retrospective review. This is a very large scale international survey where we've already got ethical approval for this study. And the rationale for this is to really get a stronger perspective as to what people found helpful from EMDR training, what did they think was fit for purpose, what were the things that were not helpful, and so that we can then start to create a model of good practice of what we think should be included in the next generation of the teaching and learning of EMDR therapy. And one of the goals within that is to acknowledge the fact that in this COVID-19 pandemic area, there's been quite a lot of diversity in the way in which EMDR therapy has been delivered, from moving to online or various virtual sort of platforms. And so this is why it becomes very important for us to really examine what we think is the core characteristics of making EMDR therapy fit for purpose for the next generation. So it involves a lot of exploration work. We can't emphasize enough the fact that it really is essential that we take a very global perspective of both the teaching and learning of EMDR therapy, but also in developing these core accreditation criteria. So that's the basic essence of our group. Thank you.
Thank you for explaining, Derek. And thank you, everybody, I should say. We wanted to conclude by saying, well, of course, you see here the chairs of the separate work groups, and we are, of course, the link pins to the steering committee, right, where we discuss together all the things that happen in the subgroups, and the subgroups are at work very, very hard to accomplish their goals. But we also want to be link pins to you, to the ones that are listening right now to this recording at the EMDR conference. And we would really like if you would reach out to us if you want to be of any assistance, or if you have any great ideas, because I think the future of EMDR is not only in the hands of the Council of Scholars, but is in the hands of everybody here. So you can see here on the slide the email address that you can email towards. So it is info@emdrtherapy.com. And well, I really want to thank you also on behalf of all the other chairs, and of course my co-chair, Dini Laliotis, the co-chair of the steering committee, together with me. And I thank you for watching. Dini, you have anything to say on that as well?
Thank you, Susie. As always, a pleasure to co-chair with you. I just want to add that we have ambitious goals for the future of EMDR therapy, for sure, as you can see from these presentations. And while there's always been a tradition of innovation over the years, how EMDR evolves in the generations to come is in our hands now. We have to find a balance between maintaining the foundation of EMDR as well as encouraging innovations in order to keep the work dynamic, so we can continue to meet the needs of our clients and various communities all over the world. So as Francine would say, EMDR is about stopping the generations of trauma so we can foster peace in the world. Thank you so much for listening.
Thank you, everybody. Bye.
Bye-bye.